Good morning, good afternoon, good evening for those who are following us across the world. And we're looking at public health and geopolitics. This is a time that the world faces man-made environmental catastrophes, flood, fire, cyclones, a huge range of geopolitical issues. But in public health, we have to ask the question, have we failed to understand and address all these geopolitical trends, things like the advent of oligarchies, the super rich, populism, the big technology, the influence of the super rich, of fossil fuels, of religious fundamentalists. And in each of these questions, we have to ask ourselves, what action should public health people being taken? And to answer these questions, we have a fabulous panel. Bettina Borish, the CEO of the World Federation of Public Health Associations, Emeritus Professor in Global Health at the University of Geneva. Melissa Sweet, independent journalist in public health and the founder and manager of the Croaky blog. Chuck Johnson, the International Physicians for Prevention of Nuclear War. Dula Schiller, who's the chair of the World Federation Working Group on Emergency Preparedness, and Mary Codd, the president-elect of the Association of Schools of Public Health Health in Europe. It seems to me that this is a fabulous opportunity, and I'd like to begin the webinar by asking a question to Professor Bettina Borish to get the ball rolling. Bettina, tell us about whether or not public health professionals should get involved in politics, and if so, how.
Thank you, and good morning, good evening to everyone who's listening to us. I start by saying in my first life, I was a pathologist. And the father of modern pathology, called Rudolf Virchow, said, politics is nothing but medicine at a larger scale. He was convinced that social inequality was the root cause of ill health back in the 19th century. Even though some of his ideas may be a little bit outdated, a lot of the core ideas still resonate. And especially if it comes to public health, if we look at populations, population health can only be dealt as a political issue. There's no other way. And there may be controversies as to how much and how important the influence of public health into politics should be. But that it's our task, there is no doubt. And I think it's even our finest task. Health is a political choice, as we say, and it has been shown early on that, look at the North Karelia project, the first ever cardiovascular prevention project, where in the northern part of Finland, they took strong political actions against 3 of the indicators of bad cardiovascular disease. And this political action resolved into 82% less mortality of cardiovascular disease. Look at Australia. I mean, the smoking politics of Michael as an Australian is a political choice and a political implementation. But I think that the question goes as of today. And if I look at today's role that we have, it's more than regional and national health politics. We have to look at the geopolitics. And far more than that, we should not be there delivering humanitarian aid, even if it's very important. But we have, as we do in public health, to do prevention. So we have to do prevention of conflicts. And now comes my favorite topic. Who is better placed to do prevention of conflicts? I think women are essential to sustainable peace building. They are acting as mediators, already as community leaders. They have a broader focus on negotiations. They include social cohesion and justice. And we know that their involvement in peace building leads to higher durability of peace agreements. So for me, the question is first, health is political. All the health people have to do it. The way we do it is learning democracy. So doing health is democracy at work. These are my two answers to this question. And I think for the second part, I think nowadays public health has to be a core pillar of geopolitical solutions, discussions, and I hope prevention. Back to you, Michael.
Thanks, Bettina. And I'm going to go to John Middleton. I didn't introduce John. He's the president of the Global Network of Academic Public Health Associations. And John, I hear Bettina putting an emphasis on women in peace. It's a generalisation. Some of us can think of Maggie Thatcher as one example of, if you like, the opposite. Is she right? How do we need to work to get to look at global issues, taking into account the role of women?
Well, I think Bettina's absolutely right. We had a little debate about whether to use the phrase "man-made" in the problems that we're describing. War is man-made, and there may be occasions in world history where it's been women as the warmongers, but in reality and in the present day, we have to look to a male mentality which says war is okay. The revival of the idea of conquest and complete subjugation. And we have to have more women at the forefront of negotiation and politics and opposing these terrible trends that we're seeing at the moment. Yeah, okay.
Mary, would you like to butt in on that as well?
Thank you, Michael. I think it's a very interesting thought and concept, and I'm intrigued by John's use of the word man-made. Of course, I think generally we mean mankind and not necessarily just men. On the other hand, I do think that there is a real place for involvement of men and women, but women in equal measure in discussion, negotiation. Maybe we're better at collaboration and compromise, but in many ways, I do think that it's about balance and bringing those perspectives to the table. And in that regard, looking at the world and places where women are still not in a position to participate in those types of debates and discussions. And that is one of the major issues that if there's a way in which public health can help to address that, and dare I say, women in public health, and I think that we are very well represented as women in public health, we actually need to use our voices. It's a point I was planning on making later. What are our strengths and what do we have? We have our voices. The pen is mightier than the sword, it is said, and our voices are part of that.
Hopefully. Hopefully. And this is a great opportunity to bring you in if you would like. The fundamental question is about public health professionals in politics. Are we playing a big enough role, and in particular, the role of women? You're on mute if you would like to respond to that.
Absolutely. So this is very important top point
because you're asking about how we bring professionals in politics. And me coming from a lived experience, for example, I started my career as a public health physician in Palestine, where I found myself more being involved in the spaces and need to be involved in the spaces of advocacy, doing more of the work of public health, but also being a woman, where I also had my own careers to become a physician and to enter the spaces of research and even in the international spaces. And when you have your own identity, you want to keep it and you want to present it, and you have that narrative of coming from lived experience, using the evidence you have. So I think it's very important that, as Mary said, we have our voices, but sometimes when such a professional coming from a very difficult and highly politicized environment, and it's conflict affected area, it would be very difficult to find your way through the international spaces and having your voice really being voiced. So I think this is a very important, what we're trying now to discuss, that how we find mechanisms for people coming from very difficult areas, living under very difficult conditions, to be really voiced and to see and to hear from them their own realities and how they really practice public health, and if how public health and healthcare systems being attacked and the health as a right is being politicized.
Thanks, Duhan. This is a perfect opportunity for me to segue into asking a question of Melissa Sweet about how public health professionals communicate. You've spent years as a journalist in health and public health, Melissa. We've got a long way to go in terms of communication within this global context, haven't we?
Thanks so much, Michael. And I'd just like to begin by acknowledging and letting people know where I'm coming to you from, which is a beautiful island at the southern end of Australia called Lutruwita, Tasmania. So paying my respects to Palawapakana people, and acknowledging the importance of First Nations people in these discussions and contributing more widely in global public health and peacemaking. And the importance of Indigenous knowledges and decolonising practices as we do acknowledgement of country, always thinking about the relevance for the topic that we're working on or thinking about. And so thinking about if care for country was the globe's guiding principle, we would all be in a much better place. So that was just a little scene setter. And thanks, Mike, for the question. Just to go back to some of the points that were made before we go to the question.
Please, no, that's good.
You mentioned Croaky Health Media at the beginning, and just as you were talking, I went to our homepage because we have a section featuring articles from our archives, and just coincidentally, the article we're now featuring is from 2024. And the headline was, "As wars take an increasing toll on women globally, there are calls for women to be more involved in peace processes." So that was based on a UN report making the point that women bear the burden of war, but are not at the table, usually in the decision-making where you might prevent war. So I thought that was just a lovely happenstance, really. And
Melissa, while people are thinking about that and tuning out, can I remind those online that the chat is open, and if you have any questions or comment, please go to the chat. And Melissa, sorry to interrupt you there, because I think the point you were making was really fantastic.
And I did want to drop some links into the chat, but at the moment I can only send messages to host and panelists. So I don't know if others can drop links into chats. And Mary, your comment about the pen is mightier than the sword just really rang a bell with me, because I just thought, wow, things have really changed, because in the digital environment that we now live in, where really our news and information systems have been weaponized, I'm not sure that's the case anymore. I don't know, open question, but just, I just thought that was a really interesting image that you conjured up. And the question that Michael asked about public health people communicating in this environment, the environment has changed so terribly much, if I think about over my career as a journalist, but really even just in the last several years with the digital environment and the toxic news and information space. So I think a lot of effort goes into thinking about communication strategies or public health messaging. How do we get our messages right? And far less attention is put by public health people and sector generally into how do we actually change that system? How do we take a systems approach to changing this fundamental determinant of, whether it's geopolitics or health communications? It feels like there's just been such a fundamental shift in the world in recent years, and it always seems to me to come back to that one way or another, that's so closely aligned to the concentration of power, who holds the power, the intensification really of corporate monopolies in that space, more powerful than nation states, really, and how that contributes to the undermining of public health and peace. I'd like to really acknowledge the World Federation for the way that you do Global Public Health Week, and Croaky was really delighted last week to work with the Medical Association for the Prevention of War in hosting a webinar, which was about, hashtag peace for health. And I thought, so you don't have to wait to watch the whole webinar. I could perhaps, if I've got time, please shut me up, just pass on some of the points that people made, because, not only do we have to think about transforming the toxic systems, it's also about supporting public interest journalism, public interest media. And I often think, what would public health look like if it included public interest journalism as one of its many disciplines? To see how we can contribute in public health, or what would public interest journalism look like if it included public health practitioners in the team? And we do that at Croaky, and it really is transformative for our journalism. So going back to last night's webinar, we heard from a peace journalism academic, Dr. Ayesha Jihenga at University of New South Wales, who was talking about how she's a former war correspondent working in Afghanistan. She talked about how if you bring a health lens to war reporting, it transforms the narrative, transforms the timeline. You don't see the impact of war as beginning and ending with, the immediate violence or the immediate attacks. That was very powerful. We also heard from an Australian nursing and midwifery representative who spoke about how the impact of war, what it's doing to health professionals in other countries, so not directly exposed to war, but still experiencing it through the immersion, I guess, of our news and information systems, feeling distressed. And she spoke about moving from distress to collective action, how the Nursing and Midwifery Union is doing stories around the impact of war on nurses and midwives, and the importance of storytelling, really, in transforming some of the narratives around war. Professor Rob Moody, I'm sure many of you know, public health academic, he spoke about the importance of building new alliances and networks, about supporting each other. He said, don't be afraid to be the loudest voice in the room. He also spoke about the need to develop much greater fluency in the language of power and politics, that is economics and finances. And I must say, I find it very galling personally to hear political leaders bemoan the impact of the war on the global economy without also acknowledging the terrible toll being taken on children, civilians, health and humanitarian workers and the environment. Of course, global economic shocks have big impacts on people and health and everything else. But first and foremost, we live in a community of people and environment and planet, not that the economy should always be prioritised in that way.
Indeed. And Melissa, I was going to ask Bettina if she can reflect on what you have just added. I'll give you a chance to come back. But I just wondering, because you've touched on a number of things, and of course, Bettina has played a huge role in using the World Federation of Public Health Associations as a tool for communication. Bettina.
Yeah, I think if I may react directly to Melissa, I think I like to take up her point as public interest journalism as a key factor. I think we do see the detrimental effects of non-public health interest journalism. And we see that the agenda setting, as it's called, goes to whatever and also distracts our interest. When whole media talks about a dead whale in the Baltic Sea, nobody talks about war anymore, about politics anymore. And they can do this agenda setting, journalists. And so I think there is to be, how could we call it? Public health journalism as a global common good. Couldn't we put it this way? Because it should be there. I can no longer hear the word fake news, disinformation, and so much. We should have a common global good, which is proper evidence-based information in a way that it is digestible for different parts of our societies. And I think this is as important as clean water, breathable air, the right to have a well-informed journalist or people transmitting it. So thank you for this public health interest journalism. I do react also, if I may, to the fact that yes,
Sure.
War is attractive because it's drama, but the suffering is less attractive. And so it's all in your fine line how you present things. And I think you have a very important point there. Thank you so much, Melissa.
Melissa, I said I'd give you a chance to respond, and I will before I go to Chuck.
Oh, no, thanks, Bettina. I think, your point about the importance of communications and so on. We can have all the evidence-based communications in the world, but if those underlying digital systems are set up to incentivize the sharing of hate speech, of misinformation, then it doesn't really matter how much good information we have if it's not going to be able to get out there. So it really comes back to that fundamental governance of those platforms and corporations. And
yes,
momentum is building, which is good to see.
Yeah, and that's why I think if it's a global common good, you can regulate it. You can, based on this, say, we have regulations. And I think it's time. It's really time to do that.
Yeah. Thanks so much, Melissa. Melissa, if you should be able to share to everybody now, if not, share to me and I'll in turn reshare it. And I'll move over to Chuck and physicians' prevention of nuclear war, because it seems, Chuck, from all the evidence I'm reading, that we're closer to nuclear war than we ever have been, even though those of us who grew up in the 60s and 70s had always had that fear in our lives, and now we see it back again, something we thought we had moved beyond. What should public health professionals do? What sort of role should we play?
Yes, well, as to whether we're at greater risk now than ever before, I would say the Cuban Missile Crisis was probably as close as we came to intentional nuclear war between the United States and the Soviet Union that would have killed tens of millions, if not more, people in the world had weapons been used. And the U.S. president was being urged by some of his key advisors to start the nuclear war with the Soviet Union, because the United States at the time had numerical advantages and could have utterly destroyed the Soviet Union. So that was that forbearance on the behalf of the Kennedy administration, and then the back channel negotiations with Khrushchev and the Soviets prevented the worst catastrophe the world has ever seen. But we're heading towards something similar to it. And I guess the question about risk is it's not zero as long as 9 countries have nuclear weapons. And it's sort of a little bit like Chekhov's gun in the first act of a play. You see the gun and it's prominently on the wall and it's remarked upon. By the final act, it's going to be used. And as long as these guns, nuclear weapons, remain in people's arsenals, until they're removed from the stage, they will be used at some point. We're seeing extremely irrational leaders right now. I don't think I even have to go into any depth at all. It's in fact, it's hard to find one of the 9 nuclear states in which you would say the person is fully rational. But so we have to change the debate, and public health professionals are a key part of that. You were talking earlier about women in politics and how that might assist things. I think that would be true, but part of the framing has to change as well. Otherwise, what we've seen is that women enter politics under the current geopolitical framing between nation states around war and peace. And in order to advance, they need to be just as militaristic as the men. So this is a man-made system, if we want to go back to that question. And we need to we need to change the way it's discussed. And the way it needs to be discussed is what are the consequences of war? What are the consequences in our case of nuclear war? One of the things that's been successful for us is that in talking with health professionals, IPPNW began in 1980 with a group of highly placed U.S. and Soviet doctors who were meeting in professional meetings internationally and decided that things were getting too risky and that the what nuclear weapons would actually do needed to be discussed by the world leaders and also by the public, so that people would understand that it wasn't just a chess match, it was something that could have horrible consequences. And I think we had some success. And in part, it was during this crisis period of the 1980s when Ronald Reagan became president of the United States and was threatening to obliterate the Soviet Union in terms that weren't that different than some of the ways that Trump's been talking recently. That alarmed a lot of people, and it wasn't obviously just the doctors or other health professionals who were part of it. It was part of a global movement, and a big focus of it was in Europe, as it is now in terms of this nuclear fear, because of the conflict between the U.S. and the Soviet Union would be fought out in large measure inside of Europe, and nuclear weapons could get used there. So I think when people began to think about what that would actually mean, and as our doctors would go out and give talks, public talks, and also talks to our fellow health professionals to recruit them about what the humanitarian impacts of nuclear weapons would be, then that changes the way it's discussed in the public and then eventually among the politicians. During the 80s, we had the good fortune of a more enlightened leader in the Soviet Union emerging, Gorbachev, who understood public relations very well and the public mood of fear of nuclear weapons and wanting to diffuse that. And he set up a virtuous cycle with Reagan. Also understood public relations as well. His people did, especially. And they knew that they couldn't be seen as being behind the Soviet Union in terms of offering peace. So it's that kind of a cycle that we need to somehow create again. And maybe these horrible threats that we heard from Trump this last weekend and this continuing crisis that we're having with Iran, where 2 nuclear weapon states are trying to prevent another country from becoming a nuclear weapon state. Again, all these wars are related, nuclear weapons are just the sort of ultimate end that this whole line of thinking of militarism as the solution to world problems leads us to. And I think that's like, in terms of the key message, we've been making this message fairly successfully, and now people are listening again because the threat is obvious. But this same argument applies to militarism entirely. And I know you make this argument, but I think we need to make it loud and clear that we make choices when we spend money on guns and not on health and on other things that actually help people. And
Sure. Yeah.
yes, please.
I'm going to draw you a little closer. We have a really interesting question
Okay.
online, and I'm going to ask you to respond to it, and then I'm going to ask Duha to respond to it as I lead into her question. as well. And it says in conflict-affected areas, public health relies mostly on international NGOs who keep pushing for neutrality and impartiality, even forcing the employees not to engage in the politics of their own countries. How do you think this practice is contributing to the cycle of oppression and illusion of action while reinforcing the political status quo instead of pushing for change? Now, there's a complex question, and thank you
No, that's a good
for
one.
that
It's really an
one.
important
Yeah,
one. Yeah,
yeah.
thank you. Yeah, I don't. I think that the two have to be treated separately. I mean, when a war has begun or it's about to begin, and people are either living in the country or countries where this is taking place and trying to assist those who would suffer, of course, those organizations need to remain neutral. That's any sort of activity wouldn't be expected of them. And we would expect the warring parties, which we haven't seen as much of lately, to observe the rules of war that don't that respect the neutrality of those who are trying to provide medical and health assistance. That's not in conflict with trying to prevent wars from happening in the first place, or to recovering from wars and trying to set the conditions so that they don't recur again. And so I think it's important to understand that these things aren't in conflict at all, I don't think. But it's different people, perhaps, in different roles at different times.
Duhar, I'm going to go to you, but I'm going to ask you a broader question as well. So I need you to be able to answer both. So it'll be good to get a response to that. But you also work with the World Federation of Public Health Association on emergencies. And so the real question is, and war is one of those emergencies, but also all the other areas from climate change to pandemics and so on. What is your response to that question first, and what do we do about prevention with regard to what do public health professionals do about prevention with regard to emergencies? Can you work those in for me, please?
Okay, so for the first question, actually, regarding the neutrality and impartiality, and we have seen this discussion going a lot, especially in the last 3 years, how we gonna be neutral, why we are seeing something and we need to take a stance towards, and what does neutrality and impartiality even means, and even the ethicality of all the situation. And I think we can't equal being neutral for being silent. We need to speak up for what is happening regarding any conflict. And we usually, when I have discussions all around, and even with Bettina, we say no conflict is above any other conflict. And we need to be aware and alert as public health professionals that there is some part of the ethicality and duty to speak up about the situation in a way that we are speaking on behalf of the people. Sometimes I put myself aside and it's like, okay, I'm not speaking politics. I'm not a politician. I do care about the health of the people and the situation for the people. From where I'm coming, from the narrative I have built in, the system I have been born and raised in, and even educated in. So I think this is how you see stuff and what is your positionality to things. And this is also a very important discussion. Like, what is my position in this? I'm coming from under the developed educational system, for example, but I got my education. Was able also to succeed in multiple of the international platforms. So I think it's only about how you see stuff and how your narrative. And I can understand that we keep those neutrality, impartiality, and those ethical part, but at the same time, we need to think how we really public health does matter to people's life, and it's not always the same for us. If, for example, I'm coming from the global north, it's never will be seen as someone coming from the global south. And I think and also, for example, I'm not a non-medical person. No, I'm a public health person coming from the global south that's seeing stuff totally differently from how the global north sees them. So sometimes even the positionality itself, it does mean something. And we have faced a lot when we try to publish some some stuff different all around the world, like commentary piece or even an editorial stating the situation in our countries. And even now, the situation happening is very politicized. Like, if, for example, if you want to talk about the whole region, okay, the whole region, we have some political stuff. We can't talk about some people, we can't talk about other, which is like some level, it's somehow pity. We work for the people. This is where I stand for. Maybe my mandate came from that because I started volunteering, I working with people. So I grown up feeling like whatever I say, it should be for the people, for the health of the people. And then you found yourself trapped with the geopolitical situation, with the geopolitical realities that, and even politicized environment. It doesn't just mean like one politician or one country against the other country. It's also sometimes you've grown up in a very politicized environment that you are not allowed really to be that of much of taking your position as a neutral person or how they gonna figure me out. So it's so I think in such realities those terms need to be really clarified, and we really need to stand for ourselves and to see what does it mean to us. And if we speak up today, would it really matter for the health of the people and the health systems there being under attack, being under conflict? So this is
And look,
really, yeah. So I think
and,
we need to look at it from such angle. I don't have a perfect answer, and I don't think anybody in the world should have a perfect answer for this, because every one of us coming from different perspective, and our perspectives and narratives really drive most of what we do, really. So we try to be evidence-based as much as possible, but at the same time, we have our mandates, we are standing from a place where we believe in something. And I think if we concern the health of people, I think that would give us a different lens on those terms. The other thing, yes, in the working group, we do work on other types of emergencies, of course, conflicts, because conflicts now is one of the most important topics all around the world. And unfortunately, yes, they are somehow very teasing to people and hot topic, but not in the health wise of people. It's not like, for example, now it's being normalized that if you read in the news, like a healthcare, like an attack by a measles on a healthcare facility, it's like, why it's being so normalized and people not being so reactive on that. And this is really a problem also when the journalism part, it was so interesting to hear about. So I think it's very important to see how people are being just having this normal to read about and to happen all over the world. So conflicts take a lot of our work, but also, yes, we concern the pandemics and the climate. But the thing is, even though in those, like if you'd want to look about pandemics and the climate, even the political side was taking so much of the decisions on those spaces. So we can't really say that politics doesn't make any role in the pandemics. Like we have seen what happened in the pandemic treaty since it started till this last year, and WHA is coming. And even in the climate, we see how things goes in the negotiation in COP. So it's all about politics and realities and priorities and what benefit to other. So politics, it goes everywhere, I think. And the most important thing that we need to focus on is the health of the people and how health as a right being politicized. So that's why we come here to see is, are we really being involved as actually in the diplomacy spaces, in the negotiation spaces? Are we really speaking to politicians who they do matter and if they do really care about the health of people? So I'm not, yeah.
I'm going to go. I'm going to go to John Middleton and ask him to respond. But while you're speaking, what came to my mind was Francesca Albanese and the amazing work she has done on the one hand, but how she's been extraordinarily attacked on the other hand. That the communication is one thing, but there are also powerful forces that can come back as well. John, can I hand over to you for a response before I go to Mary to ask her a particular question?
Well, I think what Dua has said and what Chuck said about, Chuck used the word consequences. And what Dua's describing is, for the large part, with all but a few of the extreme politicians, I don't think they understand the consequences. And I certainly don't think they're prepared. I mean, we said this about the last Iraq war. They would win the war, but not the peace. And people are not understanding the consequences of what they get. And actually, in many cases, the politicians are just incompetent about it. We saw that with Kristi Noem as the Homeland Security head during the Texas floods. There was just an absolute lack of preparedness. And that does have to be something that we reinforce as public health community, public health services. We have to impress on people that preparedness for all risks, whether it's a computer outage or a flood or a fire, any number of risks that we all face. And public health's got to re-grasp that area of expertise and make it ours, and sell it as ours. And it feels to me that quite a lot of what we're up against is what Dua and indeed what Melissa said about the media world we're in, that the distortion of knowledge, the creation, industrial scale disinformation, deep fake imagery, these are controlled by very rich people, and this is something that we also need to at least be understanding of, even if we can't necessarily combat it all. And we also have to be true to ourselves as scientists, professionals, that fighting disinformation with disinformation isn't going to work for us. So I hope that answers part of your question.
Look, that's brilliant. And it actually gives me a good segue to Mary and teaching public health, as most of us have and do. Mary, you've listened to this whole conversation and been part of it. Does it really, how do we turn that into ensuring that the public health professionals of the future understand what it is? What are the competencies that we've touched on today? I mean, there are broad other competencies, but what are the competencies we've touched on today that really we need to work in and to build into our teaching of the next generation of public health professionals?
Thank you, Michael. Well, we could be here for the remainder.
Easy question.
I was about to say, what a question. We could be here for the remainder of the day and the week and further. In fact, it's quite interesting that we have really kind of come to this point, and John's point about preparedness, as you've quite rightly said, is a sort of segue to what are we going to do? What can we do? And as ASFR is the mission of ASFR is to improve the health of the population by strengthening education and training of public health professionals for practice and research. And that really, I guess I was about to say that this is much more focused and granular than what we've been talking about so far, but perhaps it is really highly relevant that we consider how we now imbue the young professionals and the next generation of public health professionals with the things that we've been talking about. I could say we've sort of learned on the job, haven't we? We did not need to deal with these matters when we were going through our own training in public health, and you could call it perhaps traditional public health curricula. Now, the palette and the world has changed so much that it's imperative that we include aspects of geopolitics, including conflict, war, and indeed peace building, into our curricula. It's interesting because we engaged over the past number of years through ASFR in developing a core curriculum for public health. And that was launched at the end of 2024. And it's not that the world was completely quiescent at the time of conflict and war, but how it has changed since then is beyond recognition. And it now behoves us to deal with these matters in our curricula. In fact, John has been party to this with us and some of the young professionals in looking at what we had in global public health as a subject area within that curriculum and realizing that it fell quite far short of what we need to have in there. And we're in the process of updating and upgrading that as we speak. Actually, all of you have contributed to our second edition, unwittingly and unknowingly, through this discussion and debate. And I certainly have picked up a number of items and topics that ought to be included. But if I were to consider, and incidentally, I think it was Melissa mentioned the systems thinking approach. This is a sort of a buzzword in our curricula. And we think we know what it means. We hope we know what it means. But if there was anywhere where it applies in abundance, it applies here in looking at our curriculum. We have looked critically at our curriculum. We have looked at what was in there, and we have identified a number of interlocking themes that provide a comprehensive pedagogical approach to where we should take our curricula in public health in relation very particularly to geopolitics. And it's if you don't mind, I'll just mention these 5 areas. I'm not saying that they're exhaustive. Perhaps there are others that you would also propose. So first is the foundational ideologies and the systems of power. Now, right away, I'm going to ask, as public health professionals, do we know about these matters? Are we conversant enough as educators in this space to deal with these issues for our students and our young professionals? Do we know enough about the second item in this thematic approach, which would be the instruments of control and influence? Or we could move on to the societal and political consequences. I think that's one that we could possibly address. We have a very good handle, I think, and understanding of the health consequences in a geopolitical context. That would be our sort of 4th theme. And the final one would be public health strategy and ethics. And it was Melissa or Duha who mentioned ethics in all of this. So you can see that it is really an incredibly broad palette. We have also looked at how these align with the competencies, Michael, you mentioned. What competencies should students or our graduates have coming out of these programs? We have looked at how these thematic areas and the detailed elements, far too detailed to go into in this session, but how they align to the WHO Global Competencies and Outcomes Framework, for example, and indeed some other competencies as well, and how they align to other what you'd call subject areas within public health. And you will not be surprised to see how they align with things like determinants of health, the multifactorial influences, emergency preparedness and disaster management, public health in conflict, war, and peace building, we've already mentioned. Health in vulnerable populations. Do we need to say much about that when we know that up to 15% of the world's population could be displaced from their homes or residences? Diversity, intersectionality, and indeed economics in public health. So I'll just finish this short part by asking some questions. And the questions are, what are our challenges in relation to incorporating this broad topic, very broad area, into our public health curricula? I would propose that right now we may not, as public health practitioners, educators, and trainers, have the expertise to take this on. We definitely need to collaborate and cooperate with political scientists and people who understand and know more about these topics than perhaps we do. They also need to understand the perspective of public health on all of these matters. So collaboration and cooperation here is essential, and not just political scientists, but behavioral experts and so on. What else do we need? So we need expertise. I would propose we need courage. We've been talking here today about speaking up, speaking out, I think everybody mentioned voices or pens or speaking or whatever. So what strengths do we have to facilitate that? Well, first of all, we have evidence in abundance. If anyone can collate and present the evidence in relation to the impacts of geopolitics on health, human health around the world, we must be the people who can do that with our skills in critical appraisal and systematic reviews, systems thinking and implementation science. We have strong networks. World Federation is one example. We have strong networks through the global network, through the organizations that we're all involved in. And we do have good collaborative and collective action, collaborative spirit, and so on. And we have our voices. And in fact, the voice theme and topic came up very, very early. This was one of the things that I had planned to mention in this context of what we don't have, expertise and perhaps courage. What we do have, evidence, strong networks, and voices. And I think if there's any way we can imbue these almost principles into our young people, it's a start. We have to get started and get stuck in on educating and training our young professionals.
Mary, it was a song to my ears as you talked about expertise in politics and so forth. As a former politician, health minister, and president of the World Federation of Public Health Associations, I'm so pleased to hear that we're bringing that into the debate. And you really rounded things off beautifully in my mind. But what I'm going to do is I'm going to give each person a chance now to just say a final word. We don't have too much time, so max a couple of minutes each. I'll finish up with John Middleton to give the broader thing, but the prime message that you'd like to give. And Duhar, I recognise that you were keen to say something, so I'll start with you.
It would be just a short answer for Mary's really important question because I work with young professionals and me myself, I still an early career one. I think there's very important point to keep in mind. It's very different to give a voice where you are in a system that is protecting you and protecting your career, or you are trying to give a voice or to voice others, and there is nobody or no system is really safeguarding you or giving you that safe to be loud enough. So even the environment we are operating in as young professionals, it's very different. And I would suggest that you go for scientist track and diplomat track. Maybe that would bring people who would prefer more to be in the diplomat side than the scientist side of public health. Maybe would be one of the solutions. I'm not sure. So I just wanted to say one final words that it's very important to think how we position ourselves and others positions themselves. Even in public health, we have our own biases, and when it comes to politics, we all have our visions and views on that. I was born and raised and educated under protracted conflict, protracted occupation, and then I grew up to see how really public health means for my people. So that's the voice I'm trying always to give, and I think this is what we really see public health doing more, is giving the voice of people and their health, and as a human right first. That's my final words. Thanks.
Thank you so much, Duha, and particular thanks for giving so much of yourself in this webinar as well. But Tina, can I go to you, please, before I go to Chuck? When you go off mute.
Oh, to close, I pick up on a word that came early in our discussion from Mary, the word balance. I think we are in a completely disbalanced world where power is more and more disbalanced. If I say power, it's economic power, it's political power, and in consequence, health power. I don't even put it into north, south, or whatever. I think we have the ones who have the power and the ones the powerless. And that starts to be more and more important and influences the work we are doing as health professionals or as also politicians, journalists. And to the initial question, public health and politics, I think that if we listen to Dua or others, the bare existence of you being a professional in a given setting is a political act. So you adjust there and you're already politicized. Think of what the women in Iran did, just simply going out, and they were political messages and attacked for that. So for public health people, I think we can definitely not divide, but we have to learn to fight against the disbalances. May there be financial, may there be power. Power is finances. May there be gender-wise, may there be a system such as patriarchy. But we see the increasing disbalance. And I think for me, that's a common theme throughout everything we had here. And thank you for
Thanks,
all of you.
Benita.
Back to you.
Yeah, the time is tight. So, Chuck, can I go to you then? Melissa, please.
Yes, this has been a really great session. Thank you for allowing me to participate. Yeah, I agree with Mary about collaboration being essential right now, and also this point about courage. A lot of people see things and hear things and know things, and they aren't saying those things, and we need to be saying them. And the funny thing is that when people do say them, it becomes popular. We're seeing that it's expressing something. This current paradigm isn't working for a lot of people. And so talking about what's wrong with it and talking about what we see in terms of this imbalance that Bettina was talking about is popular. We're seeing in Spain right now, the government has spoken for nuclear weapons disarmament and has gone completely anti-war and has decided it's not going to match NATO's increase in the amount of money spent on military. And it's extremely popular. It seems to be helping the future of Pedro Sanchez's government. So this is what needs to catch on, and we need to all feed off of one another because there is a yearning in the world for a different way of living, and for living at all, And we can't address these other problems as long as these violent conflicts and we're settling things through violence. It's impossible to reach any other conflicts and other important areas, deal with the issues of inequality of wealth and everything else. So all these issues are wrapped together and we need to speak about them. And I'm excited by this session today. Thank you.
Yeah. Thanks, Chuck. Melissa, to you, and then to Mary.
Thanks, Michael, and everyone. Yes, and I mean, that is the word that also strikes me very much, courage. And Michael, I know you mentioned Francesca Albanese, and what incredible courage, and also exemplifying, the really ugly, toxic nature of power, and that it is dangerous to speak up. When you wonder why people or organisations remain silent. So thinking about how to break the silence. I mean, courage is not only an individual quality, obviously, you create it through networks and groups and collective action as well. And I think the other thing that can sometimes uphold the silence in public health is, those dreaded silos, people working in their particular spheres, and it's not my place, it's not my lane to speak on all these other big issues. So I really think, it's really so important for public health to bust those cycles in a time of polycrisis, to bring the polycrisis to every public health silo, to every public health topic. So if you're talking about alcohol, how does that link into planetary health crisis, to the war and displacement crisis, to the crisis in our news and information systems, to inequity, to the crisis in our governance and democracy? And Chuck, so agree with you that there is a yearning for a different way, and the asymmetry of power. I mean, so to bring those sort of issues to absolutely every public health silo and topic.
Melissa, we're so lucky to have you and the broad insight you give and how you go to the nub of issues again and again. So thank you so much. Mary, can I go to you then to John?
Okay, thank you, Michael. So I guess I would just want to pick up on that word courage. One of the things that I had intended to do was expand a little bit and ask, why are we not courageous? And is it because we're concerned that we'll be found wanting in some way, we don't really fully understand, or we don't know should that stop us from speaking out? Are we worried about consequences? Melissa has touched on that, and I do think that that's a real concern. The consequences can be sidelined, removed from position or whatever. Perhaps, though, there's something to be said for persistence. If we all consider how important it is to speak out, be courageous. I once had an opportunity in the context of COVID, actually, to say we were courageous in relation to particular activities. We were courageous, but perhaps not courageous enough. I would just make a separate point, and Melissa, I'd love to have commented a little more on what you talked about in relation to journalism, and I think also Bettina picked up on the journalism and on, what did you call it? Public health interest journalism. And I do think that's something else that can really come out of this this session. Public health interest journalism. We also had an example recently of something being reported in the health space, which I found to be very populist in its orientation. It really didn't extract from the roundtable discussion in this particular one the essence of things that we did well and the things that we didn't do well. It was actually about preparedness for COVID-19. We're having our national evaluation at this moment. What was picked out was very populist. And I would also like to consider that we could talk with leading people like you in the journalist space. I'm struck by many years ago, the Statistical Society in the UK, Royal Statistical Society, ran a program of education for for journalists on, let's say, call them medical statistics, interpretation of information and data. And perhaps there's an opportunity for us to engage in a much greater way with people in your specialism and in your profession. So thank you. Random thoughts at the end, Michael.
Lovely set of different thoughts, and we're going to ask John Middleton to bring them all together and share his reflection on the webinar before I do the conclusion. John, over to you.
Thank you, Michael. The big single thought that came to me from this session was Dua's comment: neutral is not silent. And I think that goes back also not just to a conflict situation and humanitarian aid. It's the essence of public health as well. Public health is political, but it cannot be party political and it cannot be partisan. And so we have to understand the way what we are operating in and for what purpose. But wrapped up in that also, I think, is a reassertion of our ethics and our values. It's become unfashionable to be a vocation, a service, a profession. Certainly, we see in the current times, populist leaders don't value expertise, they don't value professionalism. And they wish to, and they certainly don't wish to employ people who will give them information they don't want. So we have to reassert our values and our belief in the health of people. What would not be popular about trying to make people healthier and to reduce inequality? Well, reducing inequality, obviously. And we are in a world where that inequality is getting bigger. Billionaires don't have to earn any money. It just grows for them. It's passive income. And they don't know what to do with it. So they can buy up newspapers that lose money. They can buy up social media and just inflict their opinions on the world. So these are the environments in which we face. And at the same time, climate change and conflict are the major real threats to people's health and to migration and to exacerbating health problems around the world. just one other thought that came really from Melissa's very first point, and the acknowledgement of the indigenous peoples. It seems to me indigenous people are the canary in the coal mine, really, for so many problems around the world that are caused by fossil fuel exploitation, by big food exploitation, and general suppression of people's rights. And we have to constantly refer back to the idea of health as a human right. And we see that also in Palestine at the moment, of course. So we do have to have courage in all of that, but we also need to be in solidarity. And I am worried by a number of institutions that I work with who try to keep their heads down and just do the job and compete with their neighbours for student income. We have to be in solidarity. We have to be in the global institutions that can represent us, like Global Network for Academic Public Health, World Federation of Public Health Associations, and so on. So, as well as courage, I would say solidarity and maintaining our professional and knowledge, our expertise, and our humanity more than anything. Thank you.
Thanks, John. I'm going to give Bettina an opportunity because we do need her to comment on the World Congress on Public Health. I think the link was put into the chat earlier. Bettina.
Yes, I would just like to invite you all to the World Congress of Public Health in Cape Town, September 6 to 9. The topics we have been discussing today will be very high on the agenda. And just to let you know, the name of Francesca Albanese was mentioned twice today. We hope to have her as a speaker in Cape Town. So our topic of today will be a very important topic also in Cape Town. Thank you to all of you.
Okay, and to conclude this webinar, remembering that it is part of World Public Health Week, a particular thank you, I'm going to go follow my screen, to Chuck Johnson, to Bettina Borish, to Melissa Sweet, John Middleton, Mary Codd, and Duha Scheller. For the organisers who've put this together, Priscilla Robinson, thank you so much, because this has been such an interesting one, and I hope many people see it online, apart from those who have been with us today as our attendees. Thank you to those as well. And with that, I now draw this webinar to a conclusion. Thanks, everybody.